Hey, it's Peter Morley, your patient advocate. Did you know that there is a mental health caucus in Congress? And Congresswoman Susan Wild is a part of it. She's going to tell us what she's working on in the mental health space. Thank you so much for what you're doing, Congresswoman.
Thank you so much, Peter. Thank you. I love to talk about the importance of mental health, and this is Mental Health Awareness Month, so it's super important that we all raise the issue. It's been one of the areas of special focus for me in Congress. You know, I have to say, we're a great country. We have a lot of great people, great traits, hard work, discipline, courage, and strength. But these same traits are often why it is so hard for people to ask for help sometimes. So I want to make sure that we make it easier for people to ask for help. One of the bills that I introduced passed the House, passed the Senate, and was signed into law. Wow, that doesn't happen all that often these days. Is the Dr. Lorna Breen Healthcare Provider Protection Act, which helps reduce the stigma of suicide, burnout, and mental health conditions among healthcare providers who take care of us. And that's something that came to everyone's attention during the pandemic. And it's just so important. It's named after an emergency room physician who took her own life after working incredibly hard on with COVID patients in New York City, which was kind of ground zero for the pandemic at one point. And then we've passed through the House the Enhancing Mental Health and Suicide Prevention Through Campus Planning Act, which focuses on making sure that college students have access to better and more comprehensive mental health care on campuses, and specifically that campuses are developing suicide prevention plans. So those are just a couple of the things that I've been working on, but we as individuals and together as communities are much stronger when we have support systems in place to reinforce our strength and to help us bounce back and to be resilient. So I think these are just critical things that we must work on.
I agree, and thank you so much for working so hard on these critical mental health issues.